How to remove a mouth ulcer. Painful, annoying mouth ulcers can pop up anytime, usually during periods of stress or illness. Luckily, it's pretty simple to get rid of them on your own, using a number of home remedies. But if the ulcers are really stubborn, you can always seek medical treatment. Use a saline rinse. Rinsing your mouth with a saltwater solution can help disinfect your mouth ulcer, keeping it clean from the bacteria that naturally occurs in your mouth and preventing aggravation. Mix a teaspoon or two of salt with a warm glass of water. The exact ratio isn't important, as long as you're not using so much salt that you can't keep the water in your mouth. If you don't have salt handy, or you can't handle the taste, use a pinch of baking soda instead. Hold the saline solution in your mouth, and swish from side to side. Spit the solution into the sink. Don't swallow it, otherwise, you'll find yourself dehydrated. Repeat a few times a day. It's a good idea to do it again after meals and before you go to bed. Apply some honey on the ulcer. It may sting painfully a bit when you apply it, but it is quite effective. Dab the sore with hydrogen peroxide. Like a saline rinse, hydrogen peroxide can disinfect the ulcer. Mix 3% hydrogen peroxide with an equal volume of water. You won't need much for this treatment, a quarter cup of each should do it. Dip a cotton swab in the solution, and dab it over the sore. Once you've done the initial cleanup, dip a fresh swab and hold it to the sore for a few seconds. Don't swallow the solution. Hydrogen peroxide isn't meant to be swallowed. Make sure you're using just enough solution to wet the cotton swab. Repeat once or twice a day. Try to do this morning and night. Suck on ice chips. The cold can reduce the swelling of the sore, as well as numbing the pain. If you can, use your tongue to hold a chip directly against the sore. Carry around a cup of chips, if you can. Keep them in a coffee thermos or a styrofoam cup to prevent rapid melting, and use them throughout the day. Drink cold water. If ice chips are too cold for you, try to at least drink cool water throughout the day. Reduce acidity. Some canker sores can be caused by excess acid, or too low pH, in your mouth. Here's how to get back to the right balance. Avoid acidic foods and drinks. Steer clear of carbonated drinks, citrus fruits, spicy foods and hard foods like toasted bread. Chew antacid tablets. Take a tablet a few times a day, especially before eating. Dab milk of magnesia on the sore. Once or twice a day, put some milk of magnesia on a cotton swab and gently dab it over active sores. Use mouthwash. Rinsing out your mouth more often will clear out any aggravating bacteria, as well as easing the pain of the sore in some cases. Use an over-the-counter solution. Just about any mouthwash will work for this purpose. Swish it morning and night, and maybe after lunch as well. Use a diphenhydramine suspension Washington. These rinses, such as Benadryl allergy liquid rinse, can help dull the pain as well. Spit it out. Never swallow mouthwash. Use a lemon. Slice a lemon in half. Apply it on the ulcer. It may sting a little, but it will be numb, which is good. Finish up by adding some honey. Use baking powder and lemon. Mix 1/4 of a teaspoon of baking powder with a freshly cut lemon, squeeze all the juice out, into the baking soda. Add a tablespoon of cold water and half a teaspoon of honey. Finally, mix until it's all blended in. Apply it to your ulcer. Do this twice every day, once in the morning and once when you're going to sleep. After a week, this should have cleared the ulcer. Manage pain. If you can't get rid of your mouth ulcer as soon as you'd like, you can at least try to forget about it. Take an over-the-counter pain reliever. Avoid taking aspirin if you're 18 or younger. Use a numbing gel. These are sold over the counter at most drugstores for infant teething or toothaches. Dab it gently on the sore every few hours. Visit a dentist if the sore lasts for 3 weeks or more. Most mouth ulcers should go away on their own in 2 to 3 weeks. If yours is still sticking around, schedule an appointment with a dentist. A dentist can help you make sure your problem is actually a mouth ulcer, and not a tooth abscess or a rare form of oral cancer. Request a corticosteroid gel or medicated mouthwash. If you do just have a stubborn mouth ulcer, ask your dentist about using these prescription treatments. Fluocyanonide gel, Lidex. This corticosteroid can take down swelling and ease the pain of your canker sore. Alert your doctor if you're pregnant or breastfeeding, or if you have an autoimmune disease, you might be better suited to another treatment. Chlorhexidine gluconate mouthwash. This mouthwash that's used to treat gingivitis and cavities between teeth, can also heal mouth ulcers. Schedule regular dental checkups and cleanings. Consistent oral hygiene can prevent mouth ulcers from returning. In addition to brushing your teeth twice a day and flossing once a day, consider seeing a dentist every 6 months for a professional evaluation and cleaning.